Hello. Medicare uses different terms to mean similar things and similar terms to mean completely different things. For years, you've probably had an HR department who's helped you with your healthcare options, and now you are the HR department. Medical offices speak in generalities, as does Medicare if you have the time to call them. Your friends and neighbors each have their own opinions, as do your family members, about what you should be doing in the Medicare space. I think you can agree that Medicare can be a bit of a tossed salad. Today we're going to try and deconstruct some of those things so that you know the difference between jicama and water chestnuts. My name is Dan Paterka. I have an agency here in Newport Beach. We have a number of agents who can help you with any questions that you may have regarding Medicare. We provide advice on how to leave employer group health plans. That's your employer coverage after you've turned 65 and if you've continued to work, where to apply for Medicare, and other things related to Medicare health insurance. Today, we're going to look a little bit beyond what the basics of Medicare offers to you and see what options are available once you have the foundation of Medicare, which is Part A and Part B. So we're going to cover some general information, do a quick summary of Medicare, a quick look at the parts of Medicare, because again, this is not a basics class. We're going to talk about HMO versus PPO. These are group plans within the Medicare world. And then we're going to talk about individual supplements, which are relatively unique to Medicare. Talk about the network that an individual supplement would have, as well as Medicare. And then we're going to tie it all together into what we call coverage options. I'll leave you with contact information, and at the end, we will also field any questions that you may have. I'm being ably assisted today by Haley, and so if you have any questions, please type them into the chat box, and she'll forward the questions to me. Thank you. Okay, so general information. Again, not a basics class. This is a quick review of what Original Medicare has to offer you. The Centers for Medicare and Medicaid Services, we know them informally as Medicare. They are charged with plan designs and the rules that sort of surround what Medicare offers. They are one of the two agencies that you can trust to give you reliable, if sometimes vague, information. The other one is the Social Security Administration. They're in charge of bringing you on board into the Medicare system and charging any premiums that may accrue to you under the Medicare system. Medicare, or CMS, is there for your protection. They want to make sure that whether you're 65 or 105, no one is taking advantage of you. They're not calling you at 6 in the morning trying to sell you a policy. They're not buying you a meal so that you try to feel you feel obligated to buy a policy from them. Along those lines, during COVID, there was a proliferation of 800 numbers. You had J.J. Walker, Joe Namath, and a number of other celebrities touting these plans that would give you everything, when in actuality those plans weren't available in your area. They were national ads, and so they ran them nationally, and people were misled, and then their names, when they called in, were passed along to people who bought the lists, and you would get called by 10 to 20 different people 10 to 20 different times. So to that end, Medicare has required us to now start recording every phone conversation we have with beneficiaries. Now, you can avoid this by contacting through email or text or meeting the agent in person. None of those things are recorded, but the calls will be recorded, and you just need to be aware of that. A word about sales agents and brokers. I'm a broker. Sales agents and brokers, neither of us charge fees. If you have a sales agent, they represent an insurance carrier. So you would get the full line of Ford products if you went to an agent. If you go to a broker, it's like going to a CarMax, where you get a number of different choices. We can compare plans for you and so on. So I think it's nice to have a broker, but that's because I am one. Every time you meet with an agent or a broker in person, you are required to sign a scope of appointment. It is a permission slip, essentially, and what it does is it allows me to talk to you about Medicare, only the things that you want to talk about. So some agents sell long-term care, life insurance, and so on. We don't do any of those things. Our focus is Medicare, but it does limit that conversation just to Medicare so that you're not cross-sold or misled in any way. We are paid by the insurance companies that we represent, and no matter where you go, somebody gets paid. So if you call the company directly, they get paid. If you go to a broker or an agent, they get paid. We're licensed by the states in which we operate, and we are certified by the carriers every year as to their products so that we know what we're talking about. We're presenting you with the most recent information. Okay, a little bit of consumer advocacy. If you go into a doctor's office and they want to perform a procedure, you would not ask if the insurance covers it. You would ask, how much will it cost me? Okay, that seems to be a big tripping point for folks, is they asked if it was covered and they were told it was, and then all of a sudden it's not completely covered, right? You've got a percentage. So always better to ask, how much will it cost me? Okay, Medicare is health insurance for people who are aged 65 years and better. You could be under 65 with certain disabilities. That's 2 years or more on Social Security supplemental income, and then you will be assigned a Medicare number automatically. You could also be any age with end-stage renal disease or Lou Gehrig's disease. Parts of Medicare. There are 4 parts and 4 parts only to Medicare, and they are lettered A, B, C, D. A and B are your foundation. Part A is hospital insurance. That's what it's called by Medicare. I think of it as acute care. It's going into the hospital in facility services. You're automatically entitled to Part A. Through your working career, you've paid into a trust fund, and so that money is set aside for you when you become eligible for Medicare. So that's Part A. No premium associated. Part B, there is a premium. Medicare calls this insurance medical insurance. So you have hospital Part A, medical Part B. I think of Part B as the basic stuff. It's everything other than in hospital. You don't have to sign up for Part B if you don't want to. However, if you don't when you should, you may get penalized, and that penalty will go with you for the rest of your life. So we want to be really careful with Part B. You can only get A and B, your foundation. You can only get that through Social Security Administration, and only you can sign up for it. So no one can do it for you. However, brokers and agents can help you if you go into the office and you want to go online and sign up. We can do that. Part C is an alternative to the foundation A and B. You're going to an insurance carrier who's going to take care of all of your medical needs. These Part C plans are known as Medicare Advantage or Advantage. I like to think of them as group plans, and why is important, and we'll get to that in a moment. But Advantage, Group, Part C all means the same thing. This is an alternative to A and B, and you don't have to enroll in a Part C plan if you don't want to. There's no penalty associated with it. Part D is access to drug coverage, the kind of medications that you would get at a retail outlet, CVS, Walmart, Walgreens, and so on. Like Part B, Bravo, you do not need to sign up for a prescription drug plan if you don't want to. However, like Part B, if you don't sign up when you should, you may get a penalty, and that penalty also will go with you for the rest of your life. So we have to be careful with Parts B and D. They're voluntary, but you do need to sign up in most instances. Okay. I should also tell you that Parts B and D, Bravo and Delta, they both may have an income-related adjustment. If you make over a certain amount of money, you're going to pay more for Parts B and D. Okay, a little bit closer look at the major costs of original Medicare. Part A, acute and post-acute in-facility stays. If you go to the hospital each and every time, you're going to pay a deductible under Part A. The deductible is $1,600 each and every time. Ankle fracture in January, appendicitis in June, your gallbladder in November. $1,600 each time equates to about $4,800. It does equate to $4,800. One of the issues with original Medicare is that there's no upper limit to the amount of money that you'll spend as a beneficiary, a receiver of benefits under Medicare. If you go to a skilled nursing facility after your hospital stay, after the first 20 days, they will charge you $200 a day up to day 100. And after day 100, if you haven't shown continuous improvement, they're going to say you're stable, but your needs are greater than what Medicare covers. Long-term care coverage is what kicks in at that point. Okay, so you have 100 days in a skilled nursing facility. The first 20 days are at no cost. After that, $200 a day. Part B, the basic stuff, the day-to-day, has an annual deductible, a single time per year, the very first, right? And this year it's $226. It's not a lot of money. It's more of a speed bump to keep you from going into the doctor for a Band-Aid. After you pay that deductible, you have coinsurance, which is a percentage. Medicare will have an 80-20 split. So let's say you go to a provider under Part B and they want to charge you $200. They send the bill to Medicare, and Medicare says, we only allow you to charge $100 for this. You have to write off the extra $100. There's no balance billing in Medicare, original Medicare. And we will pay you 80% of this $100 that we allow. The other $20 you can get from the beneficiary. So that's that 80-20 split after your deductible. There are some providers under Part B, non-emergency, who will not have a contract with Medicare. And what they'll do is they will charge you an administrative fee to provide services for the billing. And so they'll tell you, look, I don't work with Medicare. I'll prepare the bill for you. You pay me in advance, and then I will send the bill to Medicare, and you'll get reimbursed 80% of the allowed amount. That's kind of how a Part B excess charge works, and it can be up to 15% over the allowed amount. So in the case of the $200 provider getting knocked back to $100, now they're allowed to charge an extra $15 of the allowed amount, 15%, $15. You would be responsible for that. Now, that's not a big deal on a $200 charge, but emergency room doctors and anesthesiologists, most of them do not accept original Medicare. You'll see that excess charge. So you have to be aware of that excess charge. For Part B, there is a premium. This year, it's $164.90 per month, but it is adjusted according to the IRMA, the Income-Related Monthly Adjustment Amount. Okay, that's A and B, original Medicare. Part C, these are the group plans, Medicare Advantage. You would have to continue to pay $164.90, which, as I mentioned, A and B are your foundation. Everybody has to have that. You pay that for your Part B premium, and then Medicare will pay a carrier to provide benefits through a network of doctors and hospitals. That's how they manage to control the costs. They have to provide for everything that you would have received under original Medicare, A and B, and so you could have the exact same benefits, although most often these Advantage plans, these group plans, have many more benefits than what original Medicare might offer, and they might have lower co-pays or co-insurance amounts. Most of the Medicare Advantage plans are HMO in this area, but PPOs are becoming more popular. For an HMO, you would select a primary care physician who manages or coordinates your care. And then, of course, with a PPO, you do not need to have a primary care physician, although sometimes it's nice to have. Primary care is limited to a specific geographic area, the county in which you reside, but you always have worldwide urgent care and emergent care. So urgent care is not life-threatening. You've cut your finger, you're on a blood thinner, and you can't get it to stop, but it needs to be taken care of. You're not going to die, but we need to address it. So that is urgent care. Emergent, life-threatening. You are feeling chest pain, you've been in a car accident, things of that nature. That's emergent. You would choose a plan based on the benefits, the cost sharing, and the network of doctors. Critical for you would be, is or are my doctors in the network that I want to join here? The benefits can be very generous. As I mentioned, there are lifestyle benefits with these group plans, with the Medicare Advantage plans, and so they can be super nice for people who are willing to stay within network. Part D, this is the fourth part of Medicare, and this is the standalone prescription drug coverage. This is for outpatient stuff. You have a number of plans. In the great state of California, we have 26 different plans. Not all of them are highly rated. Medicare rates both the group plans as well as the drug plans on a 5-star basis. And the more stars you have, the better the plans are in Medicare's view. They adhere to whatever standards Medicare is promulgating at that time. So there are lots of plans available, as mentioned. Medicare is in charge of plan design, and so they know exactly how much each drug plan across the United States costs per month, and so they determine an average, and they use that average cost as the basis for your penalty if you don't sign up when you should. The IRMA for PDP, prescription drug plan enrollees, is up to $76.40 a month. Premiums vary by state and plan. If you move out of state, you need to get a new plan. Mail orders available with most of these Part D plans, not all, but most, and lots of Medicare Advantage plans. The group plans include prescription drug coverage. We're going to take a little bit of a closer look at the Advantage plans. As mentioned, there are two main types, HMO and PPO. For an HMO, you would select a primary care physician. It really represents the very best of managed care. You have to stay within the medical group, and as long as you do that, you're going to achieve the least expense, the lowest cost. It is also the most narrow network, and I'll show you a sort of a visual of that in a moment. For PPOs, you don't need to choose a primary care physician, so it offers you more flexibility. There are two pricing levels with a PPO plan, so it's sort of the next step up. There's an in-network cost and an out-of-network cost. You're likely to have co-pays, like a flat amount, and co-insurance. So co-pays are flat, co-insurance is a percentage. If you go to an out-of-network provider, you need to ask them three questions. The first one is, do you accept Medicare? If they don't, you shouldn't go to see them. Will they bill your insurance carrier? That's important too, because if they don't bill them, you're going to have to get a bill from them and send it on to your supplement, your out-of-network provider, your carrier. And the third thing is this medically necessary? So Medicare will not cover things that are not medically necessary. So cosmetology, hair restoration, things of that nature, those aren't going to be covered under Medicare. Medicare also does not cover routine dental, vision, or hearing, the three things that happen to us as we age. Medicare says, look, as long as you're able to stand upright and shuffle across the room, you're good to go. Okay, so that's not what's covered under those things might be covered under a group plan, but not original Medicare. The cost for an Advantage PPO can vary widely, as low as $0 up to $170, something like that per month. So we have to be careful with the PPO plans as well, despite their increased flexibility. All right, so if we look at HMO versus PPO networks, I'm going to have our very able camera guy kind of zoom in. So for Medicare Advantage, green means go. This is an HMO. This represents an HMO. Okay, so if you're in network, you can go to that one. You're going to achieve the lowest cost. Red means no. So if you go to anyone that's not in the network, you're going to pay 100%, and that can be a challenge for you. Okay, so we don't mind being in network sometimes, but sometimes we want a little bit more flexibility. So the next one we have, I think, will be this one. Okay, and this yellow means slow. You're going out of network, you have a higher cost, and the doctor may not participate. The yellow ones, you're going to pay more. The green ones, you're going to pay the least, and the red ones, you still cannot go to. All right, so this represents a PPO plan. So first one was HMO, this is PPO. All right, and we'll look at original Medicare, which is sort of unique in the medical space. Medicare supplements, these are individual plans. They're not group plans. They only work with original Medicare. So you've got those gaps in Medicare. The supplements will fill in the gaps. As of 2018, 93% of doctors, that's the statistic that I read, who treat adults accept Medicare. So not all doctors will accept Medicare, some do not, they just don't. The most recent information that I have is as of 2018, and that's probably the most information available. It's like a PPO, but it is not a PPO. It is an EPO, an exclusive provider organization, and I'll show you a visual of that in a moment. It offers you the most flexibility. Some of the following doctors do not accept original Medicare, and so an individual supplement wouldn't work for you anyway. So OBGYNs, some do not, and dermatologists because they do things other than just remove things from your face and skin. In California, with an individual supplement plan, you can change to a different carrier. You're not locked in to the same carrier for the rest of your life during your birth month. Okay, so in your birth month, they call it the California birthday rule. You can go to a new supplement carrier with, let's say, a lower price, because as time passes, your premiums will increase. This individual supplement is the most expensive option for you, but it does give you the most flexibility, and I'll show you why in just a second here. Okay, a little bit closer look at supplements. You can get care from any doctor that accepts Medicare assignment, what they call Medicare assignment, but also any doctor that will bill Medicare for you, the Part B excess charge doctors or providers. Monthly premiums, there are additional monthly premiums associated with individual supplement plans because it does give you the most flexibility. They range in price, but they do increase with age, and they are zip code based. So based on claims history within a zip code and your age group, the insurance carriers have different experiences, and so the pricing can be different. This premium would be in addition to your $164.90 base premium adjusted for IRMA, income-related monthly adjustment amount, and you'd want to comparison shop. So when people are looking at supplement plans, they look at maybe three things. The first is cost. The cost can vary up to $100 a month. The second thing is reputation. This company or carrier treated my mom well when she was ill. I want to go with her. I know this company from my employer plan. They do a great job. I'm going to go with that. And I'm willing to pay a few more dollars to stay with them. The third thing that people look at is underwriting. Underwriting is a series of medical questions that an insurance carrier will ask you to determine if you're a good risk. If you're outside of a window, and you can see in the bullet point below, underwriting is required. If you're outside of that window, then they will ask you medical questions. And based on those medical questions, they can decline to offer you coverage. That's the terminology. The premise is, hey, you're not well enough right now. We don't want to bill for $20,000 within the first 2 months of collecting a couple of $100. So that just doesn't pencil for us, and we're not going to do it. In the Medicare world, there are pre-existing conditions, and so you have to be aware of that. But you do have sort of the get-out-of-jail card. Within the first 6 months of obtaining Part B, you can get into a supplement plan without any medical questions asked. Okay. Let's see, underwriting is required if you're not within 6 months. These plans are considered to be portable. So if you're a snowbird, or you have a home on 2 coasts, or if you're happy wanderers, you jump in the RV and you're going to go visit the grandkids in the different states, this probably would work well for you. It also works well for people who have specialists in different medical groups. I have a podiatrist over here, a cardiologist just here, an endocrinologist here, and they're all in different medical groups, but they all take Medicare. This Medicare individual supplement will work really well for you. You need a separate prescription drug plan because neither original Medicare, A and B, nor supplements include prescription drug coverage. So that's completely unlike a group plan where they most often include prescription drug coverage. Okay, let's see if we can get you a picture of this. Yes, so this is an individual supplement network, and I'm going to have him close up on this. So this is an exclusive provider organization, right? You can go anywhere within this universe. All of these doctors you can go to see. They all take Medicare. So the question you would want to ask of the doctor is, do you take original Medicare? Straight, traditional, these are all the same, have the same meaning. Straight, original, traditional Medicare are all the same. That's A and B of Medicare. Or you can go to Medicare.gov and look up, I think it's find a provider, and see if that doctor's name appears in the Medicare listing. So green means go, in network, lowest cost. Red means you cannot go see those doctors, okay? So you can see you have a lot more flexibility with original Medicare than you would with a PPO plan, and the pricing can be about the same. So we want to be really aware of what choices you're making. You'll call a doctor's office and they may say, yes, we take PPO. What they mean is we take original Medicare and a supplement. They may also take this. Individual doctors can sign up for a PPO plan, but they do need to sign up. So those are the things that you need to be aware of. By the way, no gummy bears were harmed in the making of this production. Okay, moving forward. So these are your options under Original Medicare. You have option 1. You can go with Original Medicare, A and B, and all the benefits that we described. You do need a separate prescription drug plan, and so that will cost you a little bit more money. These plans vary in pricing from below $10 to up to $163. So it just depends on what your desires are: deductible, no deductible, cost of meds, and so on. You may like that, but Original Medicare does have those deductibles and coinsurance amounts we were talking about. $1,600 deductible for Part A, $200 a day after day 20, $226 deductible under Part B, 20% coinsurance, possible Part B excess charge, 15%. Those are really the big ones. So you can get a supplement individual that will fill in the gaps of Medicare, but it will cost you extra money. Okay, so that obviously option 1A is the most expensive way to go because you're getting a supplement plan as well as a drug plan, and you're having to pay for Original Medicare. Option 2 is a Medicare Advantage plan. Sorry about that. These types of plans, these group plans, tie everything together. You get everything that you would have had under A and B. Most often they include prescription drug coverage and what are called lifestyle benefits: gym memberships, over-the-counter benefits, transportation, hearing, dental, vision. Those can all be covered under a group plan, right? The group plans, by the way, will never ask medical questions. They don't ask you medical questions. You're joining a group, so you're part of the whole picture versus this is just for you, like an individual supplement would do. All right, so key points: you do have to have both A and B to start your coverage. Medicare allows individual and group plans to reduce your burdens, if you have any, or your exposure actually. Individual plans may have medical questions if you're outside of that 6-month window. Group plans don't have any medical questions ever. You can switch from a group plan to an individual plan. And it's relatively easy, but going from an individual to a group plan is easy. From a group plan to an individual is a little bit more challenging because they may ask you those questions. You can make changes to your group plan choices each year during the annual election period or annual enrollment period that runs from October 15th to December 7th, Pearl Harbor Day. Whatever you pick in that time frame, or however many choices you make in that time frame, the last one that you pick, you'll start with on January 1st, and you'll be expected to stay within that plan for that calendar year. During that calendar year, you'll have another annual election period to make a choice for the next year. In California, you can make changes to your individual plans during your birth month, and we offer all that advice at no cost, as well as much more. Here's my contact information. So if you had any questions and you were not able to ask them in the chat, you can contact me however you'd like. We take phone calls too, and we'll field those questions. All right. Thank you. I'm wondering about coverage for things like Prolia, injection 2 times a year for osteoporosis. Okay, so for Prolia, it's usually covered under Part D of Medicare, but it can also be covered under Part B if you've been diagnosed with osteoporosis. So if it's a preventive type thing, you're going to pick it up from the pharmacy, from the CVS or any place like that. If you get an injection in your doctor's office, that's covered under Part B. Infusion therapy is covered under Part B, and so you may pay 20% unless you have an individual supplement plan like we were talking about. So I hope that addresses that question. But if not, feel free to chat again. This, sadly, today is my last live stream for a while, so I will miss you, but we will be doing in-person presentations as well. So I'm kind of looking forward to that and not looking into a camera. Do we have any other questions? It looks like we're good for today. I appreciate your kind attention, and I look forward to seeing you outside of the glare of bright lights and cameras. I think we're done.